This is Democracy Now!, democracynow.org, The War and Peace Report. I'm Amy Goodman. We're spending the hour on the opioid crisis. Right now, we're joined by Abdullah Shihipar, who wrote a New York Times op-ed last month, headlined, "The Opioid Crisis Isn't White." Abdullah, explain.
Yeah, so the opioid crisis traditionally is considered to be white because people are looking at larger, the total numbers, which no one would deny that mostly white Americans are dying of overdose from opioids. It's about 78%. But especially in the last few years, if you look at the rates of increase of opioid overdose death rates, we find that especially Black Americans have had a stark increase in the death rates compared to other groups. In fact, more than white Americans. Since 2015, if you compare the rates of increase from 2015 to 2017, it's almost doubled. So essentially, the opioid crisis, we tend to look at it as a white problem, but when you scratch beneath the surface, you can really see that it affects the cross-sections of America.
Can you talk about what you think accounts for the increase in addiction in the Black and Latino communities?
Right. So we definitely know that fentanyl is a part of it. The CDC just released a report documenting fentanyl-related overdoses, which showed that Black Americans and Hispanic Americans showed a sharper rate of increase in fentanyl-related overdoses compared to white Americans. Now, that said, that's all we really know about it. We don't really know too much about why all of a sudden Black and Hispanic Americans are overdosing at greater rates than white Americans at the moment. But fentanyl is definitely part of that. But we don't know specifically.
You know, for a long time, there was criticism that for the drug epidemic in this country, it was not taken seriously in any national way. It was simply criminalized, not made a public health issue. But with the opioid crisis being white, it's being dealt with in a different way. You write, where the opioid crisis has affected non-white communities, the response has often been slow and inadequate. So explain, even in the case of opioid addiction, when it comes to people of color.
Right. So there's I think the two most prevalent, the two most potent examples of this are Washington, D.C. and Puerto Rico. Washington, D.C., advocates have complained that their health department has not been as forthcoming or has been as fast in terms of getting services available like naloxone distribution, naloxone being the drug that can bring someone back from an overdose. But really, the most egregious case is happening in Puerto Rico, where before Hurricane Maria, I think numbers suggested that there were about 300 fentanyl-related overdoses and about 60 related deaths. So that was like before September 2017. Since then, we have no real numbers, but advocates on the ground say that the crisis has gotten worse and there has been no state response. Unlike most places in the continental United States, naloxone is not legal for non-medical personnel to use, although some advocates on the ground are using it to treat overdose. And there haven't been any federal dollars allocated for any sort of response in Puerto Rico. So really, Puerto Rico, there isn't any, we're not even surveilling the problem, so there isn't any data to suggest how bad the problem is. But by all on the ground reports, it's quite bad.
You write, prior to entering public health, you'd been interested in incarceration and criminal justice. A big part of that, tied to incarceration, is drug policy and the war on drugs. Yeah. That you're from Toronto, you're now a graduate student at Brown University, where you say the opioid epidemic is as large.
Right. Right, yeah, and so in Toronto, the opioid crisis is quite severe. In Canada, and people are continuing to die from overdose. In Canada, Canada has taken some steps, more positive steps than the United States have, in the sense that they do have safe consumption sites, which are basically places where people can go to use drugs in a safe way, and someone is there to respond if they overdose. However, those sites, they're not funded enough. We don't have nearly enough. And governments have, like the right-wing Ford government, have attempted to restrict their actions. So Canada is is ahead of the United States in terms of its response, but there's much left to do.
And the issue of Native America, the opioid epidemic there, what you have found, Abdullah.
Right, and so I talked in the piece about how, specifically in South Dakota, a bunch of Native American tribes have launched a lawsuit against a bunch of pharmaceutical companies. But actually, in December, the CDC released a report about overdose deaths in Washington state, in which they released new numbers that accounted for misclassification of race. And they said that they speculated that misclassification of Native American deaths has resulted in a 40% previous underestimation of their deaths. So that seems to suggest that rates of like Native American, perhaps even other people, multiracial, Hispanic people, could even be higher if misclassification is an issue.
Well, I want to thank you for being with us. Abdullah Shihipar wrote the New York Times piece that we will link to. The opioid crisis isn't white. We're going to go to a break, and it's just for 30 seconds. When we come back, we'll focus particularly on Native America, what's happening with Native Americans and the opioid crisis. This is Democracy Now!, back in 30 seconds.